Well, thanks for continuing to cover this issue. If any of you would like background on it, I'd be happy to meet with you individually. As you know, what we've been doing in the House is working as a bipartisan team to address the crisis in Washington State. You've covered well the failure of the executive branch, I believe, over a very long period of time to really make this the priority that it has needed to be. What I want you to know that is in the House, we've been working collaboratively, Republicans and Democrats, and across both budgets, the capital budget and the operating budget, so that we can accelerate the vision of a community-based safety net across the state. And one of the challenges that we have is we did so much work in this space in the last budget, none of that work is yet online. So when you are able, and we're trying to get better numbers for you that we can provide for you. When you look at what's coming online, the $180 million investment that we made in last year's capital budget for the last biennium, the House budget, the House capital budget reflecting the work of operating, so we're aligning ourselves, is more than a $350 million investment. And it's across the continuum of care, from behavioral health needs to investments at Western, where we're making the changes that are so desperately needed, to Eastern, and of course the new training facility for the UW, so that we have a workforce that meets the needs of our communities across the state and across the continuum of care. In the House budget, one of the differences is that we've accelerated the building of that hospital, that facility at the UW, and we're having negotiations now with the Senate. But what I can tell you is that there is bipartisan commitment to building out a robust safety net across the state. And we're working through those differences between the House budget and the Senate budget now. But I believe that certainly, obviously, I'm more familiar with the House budget, having been one of the architects. And it really does, it builds on our past work, taking a look at where we're bringing various areas of treatment online, and then encouraging that investment across the state in a more designed way. And it's very exciting work. It's been very difficult, because if you look at our past capital budgets, what you will see is that the area of human services has been so compressed by the other needs. When you can agree and disagree, but certainly all of us agree that K-12 education funding, as it relates to the build out of those facilities across our state, has been so very important. So I think there's great agreement that we need to continue that investment. It will again be historic, just as it was in the last budget, when we're looking at our higher ed funding and continuing to invest across the state in those facilities. But where we've spent so much money in our capital budget has been in natural resources. And we need greater accountability there, because as we focus on the lives that are impacted by behavioral and mental health, we have to make sure that we're balancing the needs across the state in all of those other categories. We're working very hard to do that, and it's work that I believe has resulted in a capital budget that, certainly from the House perspective, we're very excited about. And I would point out that we had a unanimous vote out of the House on our capital budget work, and I believe that that's really reflective of the work we've been doing.